So measles is a highly infectious disease that needs 95% of the community to be immune to protect the individual, but also to stop transmission in the community. There's meningitis, there's pneumonia, there's diarrhea. All of those are vaccine preventable and are amongst the most common causes for childhood morbidity and mortality, especially in children under the age of 5. So the solutions to consider in a situation where healthcare workers might feel exposed if they run vaccination campaigns, or parents might feel reluctant to go to immunization clinics. And we're seeing this in the UK as well. We need to really, first and foremost, have a commitment that the delivery of vaccines to populations remains a high priority for health services. Then we can possibly break down the interventions that could be done into some of them being purely logistical. For example, flights are suspended all across the globe, and flights bring vaccine supplies to countries. And maybe extra flights need to be chartered to bring vaccines to countries. And for example, in the Gambia, we've already run out of oral polio vaccine for one reason or another, and that's already shown a bottleneck. Our own group has, for example, mapped out the consequences of vaccination services not being delivered even without the presence of a pandemic. And we already saw that there's a plateau of about 80% of vaccination, and that is not enough for herd immunity for diseases, for example, like measles, that need to have a cover of up to 95% in the community to prevent outbreaks. And just to give a recent example, during the Ebola outbreak in the DRC, about 3 times as many people died from measles as did end up dying from Ebola. So the consequences of not vaccinating and providing the essential services in the immunization programs are really, really rather devastating. I think it's crucial that we have data collection tools that will allow us to capture what is going on in the immunization system, who has received vaccines and who hasn't, because it's not just now that the children and anyone in the community will suffer from preventable infectious diseases. It's in a little while when the herd immunity or the community immunity has either dropped, or there are new birth cohorts of children who then, because of suspension of immunization programs, would have never seen a vaccine. And the health systems need to put in place records for that to be feasible, and the data collection systems really need to be fit for purpose. And we really probably need to think about new models of delivering vaccines and to have more platforms, and maybe not just restricting them to the usual EPI clinics,